Serious doctor of Reddit, what was the saddest death you have experienced in the hospital? I've seen too many to count at this point in my career. Here's one that sticks with me. A mother with a baby at full term was in a bad motor vehicle collision. We did everything in our toolbox to try to save the mother and the baby. CPR, massive blood transfusion, C-section, and more. Neither made it out of the operating room. Nurse here, I had a patient who knew they had very little time to live and was working on a letter to their estranged child. When I went in the room to help with after death care, I found the letter where they had only written half the first sentence before they passed. They died alone. We had a middle-aged woman come to the ER for a bad headache. She was otherwise healthy. A brain scan showed she had stage 4 brain cancer and an estimated 10 to 14 days to live. Her judgment and understanding was affected by the tumor, so she didn't understand what was happening. The hardest part was telling her husband that his wife, who was fine the day before, is never leaving the hospital, and there's nothing he can do. Doctor, a few years ago I had a 50-year-old guy on our intensive care unit who had had a cardiac arrest overnight from a pulmonary embolism, but had survived so far. He had had a colon cancer removed 1 week before and had been doing really well afterwards, walking around the ward, almost ready to go home. Generally healthy guy apart from this. Now after the arrest he was clinging on to life by a thread. I came to review him as part of my normal ward round and his daughter was there with him, very upset as anyone would be. I chatted to her and examined him, explaining what we were doing for him. She knew things were not looking good. As I was writing my notes in the corner she started just wailing, "Dad, come on dad, don't leave us now please, don't do this, I can't manage without you." I almost lost it completely. It was so sad. I spent a very long time washing my hands in the corner. Shortly afterwards I and my boss went to talk to his family about his prognosis. He was almost certainly going to die. It was his wife, daughters, and 75-year-old mother. I could hardly look his mum in the face as we were talking to them. Old people crying has to be one of the hardest things to see. Normally they are tough as nails. Then the cardiac arrest alarm went off. I looked at them all and ran out of the room. It was him. We couldn't save him. I was the junior resident on call for neurosurgery at a busy university. I was in the emergency room on a Saturday morning just after rounds, checking in on some non-urgent consults. The ER was quiet that morning, and I was talking with one of the ER docs. Suddenly, the doors to the waiting room burst open and a man, crying in distress, ran carrying an unconscious, lifeless looking 8-year-old boy. The nurses quickly trudged the patient into the trauma room. ER docs and the trauma team arrived. Morbid curiosity and dread kept me around. I vividly remember the ER doc calling out pupils 6mm, non-reactive. That's when my dread truly set in. I suspected an intracranial bleed. The father was giving the history to the ER. His son lives with his mother. He gets to spend a week a month with the father. The child had a baseball game that day and they were sitting at breakfast when suddenly the child said his head hurt and then collapsed into his cereal. They lived just down the street, so the father grabbed his son and sprinted the 3 blocks to the ER. I remember him saying, oh god no, they stabilized the child and got him to the CORT scanner. He had a ruptured arteriovenous malformation in his cerebellum. The hemorrhage was causing compression on the brainstem and blockage of his CSF, resulting in acute hydrocephalus. I called my chief resident and attending surgeon who understood this was absolutely critical. Plan was for an EVD to reverse the acute hydrocephalus. Then depending on the child's examined IC possible or acutely versus angio suite. At this point the mother arrived. I could tell they had a strained relationship and she was upset at the father, who was in tears. She was agitated right until the point where she saw the child now intubated with fourth arterial lines coming out of every limb. At that point she broke down and they embraced in their sorrow. The patient was taken to the ICU, where I was setting up to place an EVD, drain placed through the skull into the CSF spaces in the brain, to monitor pressure and drain fluid. I was moving quickly, because I knew time was of the essence. I was in the procedure drilling a hole in the skull, while the rest of the room was full of nurses drawing medications ECT. At that point it's somewhat like what I expect an NBA player feels like when he is shooting a free throw. I don't notice anything except the task at hand. I looked up to ask the nurse, to get the collection bag ready, and through a crack in the door/curtain I saw the mother and father watching me. The look on their face I will never forget. I see it as clearly now as I did then. 1,000-yard stare. Faces soaked in tears, but eyes now dry. The horror setting in more and more. I froze and that moment will stay with me forever. In an instant, reality clicked back in, and I asked the nurse to close the curtain. EVD went in. My attending and chief arrived. The circumstances were dire. The pressure on the brainstem was too much to go to angio and decompression had to be done in the OR. After a short discussion about the procedure, the parents told my attending to do whatever he could to save the child. We rushed the patient to the operating room, positioned him on the operating room table, and his heart stopped beating. Between the nurses, surgeons, and anesthesiologists, we did CPR for 30 minutes knowing that it was in vain, but not knowing how to stop. Perhaps we were imagining our own children. The walk out of that, or down the long hall to the waiting room, is impossible to describe. The thought of it still brings tears to my eyes. Not 5 minutes after walking out of that meeting, I got a consult for a 3-year-old who fell down concrete stairs in the ER. My attending decided to see it with me. The patient was roomed in the same trauma room. I had flashbacks walking in. Now just 5 hours later, the first patient's blood still speckled on my shoes. The child was crying, but playful with a little lump on his head. Brief history was obtained. Witnessed full, no loss of consciousness. My attending, still in his scrubs, sat next to the concerned mother holding the baby. He gently touched the toddler's head, feeling for fractures or dents, and assured mom that everything was fine. The dichotomy was striking to me. He walked out of the room with a kind of tired look on his face, and he told me days like this are why you'll want to retire early, but why you must keep trying. The attending and I went to the funeral a few weeks later. 3-year-old child had been left in the care of mom's best friend. He was beaten, burned, and sodomized. He was found in critical condition when friend and her boyfriend called 911 after he fell down the stairs. Irreversible brain damage. Couldn't imagine the pain he went through. He died a few weeks later. Luckily, friend and boyfriend eventually went to trial and were locked up. Tore me up for quite a while. Anesthesia resident in St. Louis, on my pediatric rotation. Went down to the ED for a gunshot wound, arrived to the trauma bay, and found a crowd of providers doing chest compressions on a girl who couldn't have been older than 4. She had a very active bleed coming from a bullet wound in her sternum. Intubated, 4th access, gave fluids, EP, and after 20 minutes of coding they called it. The collective weight on everyone in the room was palpable. Nobody knew her more than 20 minutes, but goddamn, is it sad when an innocent child dies. There are a few that stick with me. I'm gonna try to use layman terms as much as possible, but if anyone wants me to elaborate I can. A 32-year-old woman developed a necrotic bowel, dead guts. We coded her for an hour, because we would continue to regain a heartbeat for a few minutes at a time, and the family took that as a good sign. Finally, we get a strong heartbeat, but I felt like the damage had been done. Over the next few days she deteriorated, until one morning I come in and find her pupils are blown. She was absolutely brain dead. She wound up getting pulled from life support that day, on her son's 12th birthday. A 47-year-old lady with metastatic breast cancer, but no family, and she lived in absolute poverty. Healthcare costs bankrupted her, pretty much. All she had was a house, but no electricity, water, or gas to heat the place. She came in one night saying she was really cold and hadn't eaten in a few days. We admitted her, and she died the next day. No family, no friends. The only thing she had with her was a written will leaving everything she owned, her house, to a local church. A gentleman who was a Vietnam War vet came in because he could no longer swallow. He had horrible bone cancer of the jaw, so his left lower jaw had grown to the point where he could no longer close his mouth and his teeth pushed out and into his lips. He had no insurance other than the VA insurance for veterans, and since he wanted to be comfort care they wanted to play games about getting him any kind of long-term fourth nutrition. While he was stuck in insurance limbo, we could really only give him pain meds and watch him wither away. He also died alone, and had a small service at the local DAV where some other vets showed up to pay their respects to a fallen brother. I wouldn't be able to pick one. The hardest confirmations are ones with big families. In the palliative ward, a grown mother passed away surrounded by her husband, sister, about 6 adult children and their spouses, and many grandchildren. She was about 65 pounds when she passed and had terminal apnea. It's sometimes called a death rattle, where a dying patient is gasping for air. They had to pull her daughter out of the room because she was so distraught. There was nowhere else to fit the entire family, so we ended up in the courtyard. It was raining that day, but none of them cared. The children didn't understand and kept playing, so I ended up taking them to the other end to show them the flowers while the palliative care team talked to the family. The most memorable one was a child with a recurring hematological cancer. She had a great sense of humor and wanted to grow up to be an artist. Charities visit the children's ward and they all knew to give her paintbrushes, sketch pads, etc. because she didn't want toys. The nurses put her many drawings up at the nurses station. Her parents were really struggling with all the appointments, financial burden, etc. So to my surprise, the mother fell pregnant. They were hoping for an umbilical stem cell transplantation. Cord blood is a significant source of stem cells, which could be used for their daughter's treatment. Their daughter suddenly died of an infection weeks before the mom was due to give birth.